హాయ్ ఫ్రెండ్స్, ఈరోజు మనం ప్రీవియస్ క్వశ్చన్ పేపర్లోని క్వశ్చన్స్ గురించి చూద్దాం. నేమ్ ద నాన్ స్టిమ్యులెంట్ డ్రగ్ విత్ నారెపినెఫ్రిన్ రీఅప్టేక్ ఇన్హిబిటింగ్ యాక్షన్ used in the treatment of ADHD. Options: Atomoxetine, Dexamphetamine, methylphenidate, Furazide. Correct answer: Option A, Atomoxetine. How should a nurse administer an iron injection to an adult? Intradermal in the forearm, subcutaneous in the arm, Z-track intramuscular in the gluteal, intramuscular in the deltoid. Correct answer: Option C, Z-track intramuscular in the gluteal. The expected height of normal child at 12 months is 45 cm, 50 cm, 75 cm, 100 cm. Correct answer: Option C, 75 cm. Increased depth of breathing with normal respiratory rate is called Kussmaul's breathing, Bradypnea, Orthopnea, Hyperapnea. Correct answer: Option D, Hyperapnea. The nurse enters a room and finds a patient lying on the floor. Which action should the nurse perform first? Assist the patient back to bed, establish whether the patient is responsive, ask the patient what happened, call for help to get the patient back in bed. Correct answer: Option B, establish whether the patient is responsive. The neural tube defect among the newborns can be prevented by providing iron to the mother in 3rd month, folic acid to the mother in the 1st trimester, iron and folic acid throughout pregnancy, vitamin K to the mother in 1st trimester. Correct answer: Option B, folic acid to the mother in the 1st trimester. What is hyperemesis gravidarum? Morning sickness, lethargy, excessive vomiting, excessive loose motion. Correct answer: Option C, excessive vomiting. Which position is suitable for an unconscious patient while performing mouth care? Options: follows position, knee chest position, supine, side lying. Correct answer: Option D, side lying. Mr. Sharma developed a feature of depression after his divorce. Here, divorce is considered as precipitating factor, perpetuating factor, predisposing factor, personality factor. Correct answer: Option A, precipitating factor. A baby whose birth weight is 3 kg, what will be his required weight at the age of 4 years? 6 kg, 12 kg, 14 kg, 16 kg. Correct answer: Option D, 16 kg. Which anti-tuberculosis drug causes poor vision and difficulty in color perception? Streptomycin, Ethambutol, Rifampicin, Pyrazinamide. Correct answer: Option B, Ethambutol. The act of rubbing an oil onto the skin to produce a local effect is known as injection, inhalation, inunction, infusion. Correct answer option C, inunction. A 50-year-old man presents with sudden onset of dyspnea, breathlessness and chest pain. Examination shows tachypnea, hypotension, cyanosis, jugular vein distension, tachycardia and low-grade fever. The most likely diagnosis is acute MI, acute attack of bronchial asthma, stroke, pulmonary embolism. Correct answer option D, pulmonary embolism. While providing care to a patient with hepatitis, the nursing officer should take special precautions to prevent droplet spread of infection, use caution when bringing food for patient, wear mask and gown before entering the room, use gloves when removing the patient's bedpan. Correct answer option D, use gloves when removing the patient's bedpan. The term aphakia means inflammation of lens, absence of lens, enhancement of lens, lens disease. Correct answer option B, absence of lens. The uterine fundus height of a pregnant mother is at level of the umbilicus. Her pregnancy is about 10 to 12 weeks, 14 to 16 weeks, 20 to 24 weeks, 30 to 32 weeks. Correct answer option C, 20 to 24 weeks. As a nurse, you are monitoring a patient in immediate postpartum period. You are checking TRP and BP every 15 minutes for first hour. Which value suggests you that there is an excessive blood loss? Increased pulse rate 90 to 102, an increased respiratory rate 18 to 22, temperature 100.2 degrees Fahrenheit, none of the above. Correct answer option C, temperature 100.2 degrees Fahrenheit. While assessing Mr. Gupta with Braden scale, the score attained was 8, which indicates that the risk of developing pressure score of Mr. Gupta is mild, moderate, high, very high. Correct answer option D, very high. What is name of the opening that connects two arteria of fetal heart? Ductus arteriosus, ductus venosus, foramen ovale, ligamentum teres. Correct answer option C, foramen ovale. In which of the following genetic condition karyotype 47 XXY is seen? Down syndrome, Klinefelter syndrome, Edwards syndrome, Patus syndrome. Correct answer option B, Klinefelter syndrome. Which statement among the following is true as far as maturation of Graafian follicle is concerned? Maturation is influenced by both FSH and LH. Maturation is only influenced by FSH. Maturation is only influenced by LH. Maturation is only influenced by progesterone. Correct answer option A, maturation is influenced by both FSH and LH. What immediate nursing intervention will you take in case of blood transfusion reaction? Inform to physician, inform to blood bank, monitor vital signs, stop the infusion or stop the transfusion and monitor the vital signs. Correct answer option D. Stop the transfusion and monitor the vital signs. As a staff nurse, you are caring a patient with psoriasis. Salicylic acid is prescribed to the patient, which finding indicates the presence of systemic toxicity from this medication. Respiration decreased, tinnitus, constipation, diarrhea. Correct answer option B, tinnitus. Plebostatic axis is the point at intersection of mid-axillary line and line drawn through fourth intercostal space, anterior axillary line and sixth intercostal space, posterior axillary line and fifth intercostal space, anterior axillary line and fourth intercostal space. Correct answer option A, mid-axillary line and line drawn through fourth intercostal space. Name of the receptor on epidermis that transmits stimuli to the axon through a chemical synapse. Langerhans cells, Merkel cells, Unger cells, Burger cells. Correct answer option B, Merkel cells. Administration of Mesna with a chemotherapy agent helps in favoring the destruction of cancer cells, protecting the cell, preventing formation of uric cells, increasing production of WBC. Correct answer option B, protecting the cell. Your patient complains of dry mouth with swallowing difficulty. Which among the following drug can produce these side effects when administered in the above condition? Dicyclomine, Pyrantel pamoate, Griseofulvin, Naloxone. Correct answer option A, dicyclomine. Uterine polarity is the neuromuscular disharmony between the two uterine segments throughout labor, the neurochemical disharmony between the two segments of the uterus throughout labor, the neuromuscular harmony between the two uterine segments throughout labor, the muscular disharmony between the two uterine segments during labor. Correct answer option C, the neuromuscular harmony between the two uterine segments throughout labor. Medical treatment of coronary artery disease includes which of the following procedure? Cardiac catheterization, oral medicine administration, coronary artery bypass grafting, percutaneous transluminal coronary angioplasty. Correct answer option B, oral medicine administration. Which among the following causative organism is responsible for monolithiasis? Candida albicans, Taenia cruris, Staphylococcus aureus, Gonococci. Correct answer option A, Candida albicans. A 30 years old pregnant woman is diagnosed with pulmonary tuberculosis. Which of the following anti-tuberculosis drug should not be given? INH, Rifampicin, Streptomycin, Ethambutol. Correct answer option C, streptomycin. A disorder of thought in which patient has a false and fixed belief that members of family are trying to kill him is delusion of persecution, delusion of grandeur, nihilistic disorder, delusion of guilt. Correct answer option A, delusion of persecution. Kernicterus, which may occur as a complication of jaundice, is a pathological condition of liver, brain, kidney, heart. Correct answer option B, brain. Munson sign is a characteristic of advanced case of Keratoconus, cataract, strabismus, diabetic retinopathy. Correct answer option A, keratoconus. Rose Bengal test is used in the diagnosis of Brucellosis, Byssinosis, whooping cough, bronchiectasis. Correct answer option A, Brucellosis. Which of the following neurotransmitters is deficient in depression? Only serotonin, only 5-HT, GABA, both option A and B. Correct answer option B, both A and B. A patient receiving IV fluids develops warm tenderness, erythema and pain at the site. The nurse suspects which of the following? Fluid overload, sepsis, phlebitis, infiltration. Correct answer option C, phlebitis. Station in obstetric pelvis is related to iliac spine, ischial spine, coccyx, ilium spine. Correct answer option B, ischial spine. Inflammation of tissues surrounding the nail is known as clubbing, chylonychia, paronychia, oncholysis. Correct answer option C, paronychia. Name the neurological disorder characterized by the loss of the ability to execute or carry out skilled movements and gestures despite having the desire and the physical activity to perform them. Anhedonia, apraxia, apathy, amnesia. Correct answer option B, apraxia.